The first topic is Pearls in Pre-Op Counseling, and it is presented by Dr. Manasa Sreekumar. Dr. Manasa did her MBBS from TD Medical College, Alapura, MD from AIMS, Delhi, and then fellowship in anterior segment and IOL from Arvind Eye Hospital, Madurai. Currently, she's working at Trivandrum in Geetanjali Eye and ENT Hospital, as well as in PRS Hospital.
Afternoon, respected faculty and delegates. Let me thank you all for coming and a warm welcome. So thank you, sir, for the kind introduction. So as you can see on the screen, today my topic is pre-operative counseling in cataract surgery. So my presentation, I have divided into 3 parts. So in the first part, we will discuss how important patient education is, and in the second part, we will discuss how to validate it in a document and abiding by the existing laws by taking a valid consent, and finally, how to upgrade ourselves to meet the newer challenges. So fear of the unknown is the biggest fear of all. So a good, an educated patient, he can make informed health decisions, and we can lower surprises and ease him with the anxiety. So hence the importance of patient education, and we should tailor it according to the patient. So we don't have a one-size-fits-all concept. So now, we have to build a trusting relationship with our patients, and this is especially important when the patient is demanding, like emotionally active, with unrealistic expectations. So we can follow these pearls. So first is partnership. That is, we talk in a way so that they feel like we are a team, like I need us to work on this together. And second, and the most important, is empathy. That is, we can make them understand that we understand their situation, that is feeling with the person. So having empathy is not necessarily the same as endorsing their belief. So the patient might not be able to join us on a cognitive level, but we can find, they'll be able to find common grounds with us elsewhere. Now, acknowledgement and apology. So it's important that we acknowledge if the patient is dissatisfied with a particular treatment outcome, and apologize if we are running behind schedule or we are late for some reason. It's okay. Respect their decision. Like, respect their decision even if it is not like accepting our advice. Now, legitimate their emotions and give adequate support when necessary. So you can ask your counselor to do this, like take the patient step by step through all this process so that it makes it easy for him to understand and go through this. And I'm not elaborating on them. And do we really spend enough time in our clinical practice for patient education? If not, there are reasons more than one for us to do so. Rising litigations and false information all around, and moral reasons, like we are respecting the patient's autonomy to make a decision, and ethical reasons. And this is especially important in patients who have, who are likely to have poor visual outcomes, and in those patients who have demanding visual requirements, be it in their career or in their hobby. So the Ethics and Medical Regulation Board of the National Medical Commission in the draft regulation 2022 has stressed on the importance of consent. So any procedure requires a consent, and no procedure can be trivialized, like not even a yak capsulotomy can be done without a consent. And any violation in this level is treated as level 4, that is a suspension of license to practice from 3 months to 3 years. So this is not a procedural formality, this is a legal requirement. And there are some essential principles that is to be followed while taking a consent. So 1, it is to be taken before the procedure, and any consent taken during the course of the surgery or the procedure is unacceptable. And it is to be taken from the patient himself, and witness consents are legally more dependable. And it should be informed, like the patient's diagnosis must be there along with the comorbidities, like the systemic diagnosis should also be there. And we should explain about the treatment offered, the benefits of the treatment, the adverse effects of the treatment, the consequence if he refuses that treatment, any available alternative treatment, and the approximate cost of the surgery. And we should also know that the patient has the right to refuse to give consent, and also the right to withdraw consent at any point of time. And the consent doesn't cover the anesthesia part. We have to take a separate consent for that. And if you're planning for a repeat procedure or any extension of the procedure, that is also to be taken in the consent. So any repeat procedure, we should close the case, take a consent, only then go for it if it is not mentioned in the consent. So now about the valid format, there is no published valid format as such, but generally we include the patient details, the witness details, the disease details, and few points are that it should be taken in the patient's vernacular language, and normally we take a pre-printed fixed consent form, but that is not preferred. It is preferable if the patient, if we can ask the patient to write down the consent and sign it. And about the timing of consent, again, there is no consensus on the exact timing, but it is preferable not to take on the day of surgery because it will be considered like we are forcing it upon the patient. So common fallacies, one of the most common one is trivialization of the procedure and overlooking the importance of consent. And any alterations made, like if you strike off something in the consent, it has to be authorized by the patient's signature. This is just a few examples. Just focus on the highlighted part where the National Consumer Disputes Redressal Commission has noted that a pre-printed fixed informed consent to be of an unfair trade practice. And how suppression of vital information or providing half information is also considered to be violation of law. So the newer challenges, so the consumerization of healthcare and increasing digitalization is something we cannot deny. And varied health literacy levels. That is like patients now prefer information in their language, in their level of understanding. And the growing case complexity, like post-pandemic, there is a delay in much needed care. So most of the cases that come to us are more complicated. And greater post-discharge accountability, that is even when the patient is walking out of the clinic, we are still accountable for them. But we have newer age solutions, like wider digital front doors. Like previously, there was a time when patients used to search for generalized information on platforms like Google and YouTube. But now they prefer specific tailored information from their trusted treating doctor right to their device of choice. So some might be preferring it in their iPad, some want it in their phone. So they need that multimedia experience now. And the work that is not measured cannot be enhanced. So that is the importance of data analytics. So when we digitalize something, we can get better data, like what is that the patient searches more, what is it that they like, they dislike. And based on that, we can upgrade our patient education strategies. And there are many healthcare practices worldwide which provide patient education videos to them right at the point where they take an online consultation. That is even before they walk into a clinic. And finally, a word about video consent. This can surpass many of the flaws of the informed written consent. So, but the disadvantage is that there might be cultural barriers. They might not be willing to come in front of the camera and reveal about their illnesses. But the advantage is that the body language is very clear, so it doesn't look like we force it upon them. So like actually in organ transplantation surgeries, video consent is a must. So this is like the new thing. So basically the take-home pointers are follow the pearls to build relationship with your patients. Do not overlook the importance of a valid consent and upgrading ourselves to be future ready. Thank you.
Thank you, Dr. Manasa. Especially in this era of litigations, and especially when many of our centers are getting accredited by NABH and JCI, these points are very important. Yeah, so thank you. Next, we have our chairperson, Dr. Ambika Shetty. She will be talking about strategies for cataract surgery. Dr. Ambika completed her MBBS from Sri Devaraj URS Medical College, Kolar, MS from Minto Ophthalmic Hospital, Bangalore, and a long-term fellowship in phaco and refractive surgery from Netradama Eye Hospital, Bangalore. She established the eye department, retina clinic, and operation theatre at Gitanjali Eye and ENT Hospital, Trivandrum. Over to you, Dr. Ambika. Yeah, in the meantime, would the audience like to ask any questions to Dr. Manasa?
So, if you look at 10 years back, 15 years back, there was always the surgeon taking responsibility for any of the complications that is happening. But these days, from that frame of mind, I have changed to a situation where I tell the patient every other complication. I'll tell you the example of a judge who came for surgery. He was a cardiac, of course, and he was from the consumer court judge, actually. He came for cataract surgery, and then suddenly, at the end of the consultation, surgery planned, decided. As he was going out, he asked, "Where kuഴപ്പമൊന്നും ഇല്ലല്ലോ doctor? പ്രശ്നങ്ങളൊന്നുമില്ല." എൻ്റെ ടേബിളിൽ 3-4 ആശുപത്രിക്കെതിരായ കേസ് ഇരിപ്പുണ്ട് എന്നും പറഞ്ഞു. So then your antennae is there, okay? Then I called him back, I made him sit, and then I said, death is the biggest complication that can happen, even though we are operating under topical anesthesia. What can happen on the road or in the street or in your house can happen here also. And that is, that you have to keep in mind. And then I told him about all the possible complications. You have to take this responsibility that in case you have a problem, you have to bear with it. Whether you are the patient or my mother is a patient, it is the same. So I think in today's world, we should tell them everything. We may not use the lens that you are asking for. We may use the lens that is best for you in your given situation at that point of time. So these are the few things I want to say. Ambika, please carry on. Sir.